Yeah, so at this meeting, we are presenting two abstracts, one in patients with ZUMA-1 study, which is the pivotal registration trial, a single-arm phase 2 trial with almost 100 patients treated with Axicabtagene, ciloleucel, or Axi-cel. So we had previously reported the outcomes in these patients from the pivotal trial in all patients, where we found that at 2 years, almost 39% of these patients continue to remain in remission. So at this meeting, we are looked at outcomes in patients who are older, meaning older than 65 years or older, versus those who are less than 65 years old. And we found that the overall response rate, the complete response rate, as well as the durability of the responses were quite comparable in patients who are older, more than 65 versus less than 65. But more importantly, we also found that the safety was quite comparable in the older patients compared to the younger patients. Now, the ZUMA-1 study had 27 patients who were about the age of 65, but since the approval of the product, there are a number of hundreds of patients have been treated with Axi-cel in the US. And we've also found presenting an abstract from a 17-center consortium study. We looked at outcomes in almost 300 patients, and out of those 300, about 100 of them were above the age of 65, and about 200 were below 65. And we compared outcomes in these patients in these two groups, and we found that similar to ZUMA-1, the overall response rate was quite comparable in the older population versus younger. But interestingly, we found that the CR rate, the complete response rate, was higher in the older patients compared to the younger patients. But the progression-free survival and overall survival was quite comparable between the two. In terms of the safety, also we found that the CRS incidence was no different, both for all grades versus grade 3 or higher. And for neurological toxicity, the incidence was slightly higher for all grades in the older patients, but not statistically significant. But grade 3 or higher neurological toxicity was no different between the older patients versus younger patients. We also found that the median hospitalization for these patients was about 14 days, regardless of the age. And also the ICU admission rate was also comparable between the two groups. So overall, I think these two abstracts suggest that Axi-cel is quite safe, and the efficacy is quite comparable to the younger patients as in the older patients. We also looked at outcomes in patients with an age cutoff of 70. And even when we looked at that, the outcomes were quite comparable in patients above 70 versus below 70.